My name is Elizabeth Caton Berm. I am the psychiatric nurse at Rochester Rehabilitation. I practice as a licensed clinical social worker and a registered nurse. ADHD is a disorder that affects about 10% of school-age children. It stands for Attention Deficit Hyperactivity Disorder, and it affects about twice as many boys as it does girls, but it does affect both of them. And it is a disorder where kids have trouble focusing, paying attention, sitting still, and a lot of other things that are really important for school and other activities. The three types of ADHD are inattentive type, hyperactive/impulsive type, and combined type. So when kids are diagnosed with this disorder, they are put in one of those three categories, and it gives us a better sense of where their areas of weakness are. I encourage kids who think that they're struggling with issues that relate to ADHD to reach out to the professionals at their school. Teachers are trained to a certain extent to be able to identify some of the things we look for when we're diagnosing ADHD, and they're obviously the first line of professionals who spend the most time with the kids. Schools should also have a therapist or a psychologist on staff who would also be able to do at least a preliminary evaluation and who would also be familiar with the resources in the community that kids could be referred to. But I think it's really important to remember that we all have our own special needs. Every one of us has a way in which we are unique and in which we don't function exactly like everybody else around us. And ADHD is definitely one of those ways in which people are unique, but it is certainly important to remember that no matter who you are, every person has value and every person deserves understanding and empathy.